Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com. Aloha, Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Hey, welcome aboard and welcome back for those of you that are returning. And hello there for those of you that are just learning about our program. I almost wanted to play Battle of the Bands as an opening today because some of you that have been listening know that Dr. Juleff is a vascular surgeon. And, you know, the vascular system is pretty easy, pretty interesting. A lot of people, when they first come to our show, they don't know the difference between a vein and an artery, for example. We'll tell you about that. But then there's also different diseases of these things. And it is pretty staggering that most of you that are listening, if you haven't already been affected somehow in your family or in your person with some sort of disease. Today we're going to learn about venous disease and arterial disease. And what are the similarities? What are their differences? And more importantly, can you have both? I don't want to have both. I want Dr. Julius to fix me up right now. Am I right? Is it my imagination, or do most people not really clearly know the difference between an artery and a vein?
That is true.
No.
Yeah, a lot of people come in, and the usual thing is for people to refer to all blood vessels as veins.
That's what I'm thinking.
Yeah. And I always have to educate the patient a little bit. But there's arterial disease and there's venous disease. The arteries are the blood vessels that carry blood from the heart down throughout our entire body. And blood flows through arteries because the heart is pumping. Veins are the blood vessels that carry blood back up.
Hey, here's a question that I've never asked, because we always talk about this heart, this wonderful thing, as this vessel that just takes all the blood that's been returned up through your veins and been reprocessed and reinvigorated, and then boom, shoot into the rest of the system. But I'm looking at that being downhill. How does the blood get from your heart uphill?
That's a good question. Yeah,
and it's like a year to ask this question.
Yeah,
inquiring minds want to know.
Blood moves through veins not because the heart's pumping, but through a completely different system. Yeah. And especially the veins in our legs are they're lowest
down south.
Lowest down, and need the most energy basically to bring the blood back up. But veins rely on two things. One-way valves, those are little, just tiny little wisps of tissue inside the vein that keeps the blood moving up in the right direction, which is upward. But the valves themselves don't propel the blood. The valves keep the blood from moving back down. Mm-hmm. So the thing that propels the blood is muscular activity around the veins.
Okay.
So as muscles
squeezing it uphill.
So as muscles contract, they sort of compress the vein and push the blood somewhere. Yeah. Now, since those one-way valves are there, and if they're working properly, then it's going to push the blood upward, back to the heart. So, the problem that arises, obviously, in venous disease is that those valves fail, and that's what starts the whole process.
Yeah, and that's why we're here. We're going to take care of that, and a lot of that stuff, you hear reflux and all of that. I think people would be interested in a roll of the dice and talking about the numbers a little bit. I noticed in some of your notes for the show today that there's lots of good stats now on what affects people and what doesn't. And it looks to me like what I looked at is that, I don't know if it's my imagination or not, but it looks like it's an increasing percentage rather than decreasing. Maybe because we're staying alive longer. But I used to hear that it cost maybe about 30% of people suffered vascular disease of some kind. But now we're looking at a higher number.
Yeah, probably. Although, 30%, if you're looking at all vascular kind of problems, 30% is probably a pretty good number. But when you look at venous disease alone, I mean, venous disease in and of itself is a very, very common problem. Venous insufficiency. And I think that it's, many people have it. Unfortunately, many people don't know that they have it and have never been adequately evaluated. But, when you look at all adults in this country, for instance, 40 to 50% of adults.
I mean,
nearly
it's
half.
It's like a roll of the dice. You feel lucky.
Yeah.
See, the reason I said that is because I kind of thought that what you were going to say. And I kind of thought that, all right, that being said, look at how many people are living longer because of other medical conditions that have been medicated away so that you're okay.
Yeah.
And that this number must be, as we age, must be climbing higher.
Definitely for venous disease. Well, I mean, probably the same thing could be said for arterial disease too. But, venous disease gets worse, or the risk is higher with greater age. And I keep saying, well, yeah, it is age related, but basically that just means time is passing, and with time the venous problem worsens. And yeah, you're right. People are staying alive a lot longer than they used to, and so consequently there's going to be a higher instance of many diseases.
Okay, now what about the other one, and that is male-female? I mean, before, everybody knows this, listen to the show. I've had vascular treatment, and I inherited it from my mom. She had very bad. My dad, not so much. So it's usually thought of as a women's disease, but it's certainly not exclusive by any means.
Yeah. You're right. I mean, most people, when you say vein problems, they immediately think of women. Yeah. Typically, the number that we use is a 3-to-1 ratio. So that would mean that 75% of our patients are women, 25 are men. But I got to tell you, in our experience, it's a fair bit higher than that. I would say that probably at least 40% of our patients are men.
Yeah, and by the way, that lights true. The times that I visited the clinic, and don't forget, it's on 4 islands: Big Island, Maui, Kauai, and here on Oahu, where we're recording the show. I've noticed that too, and I see now pretty much an equal opportunity information with regards to pamphlets and flyers and things talking about different deals. They're spending a lot more time saying, "Hey, men, this is for you too."
Yeah, we try to direct a lot of our advertising toward men because men, I think, are a little more reluctant to come in and say that, gee, I think I have a vein problem. So they're typically we see them a little more advanced in the process of venous insufficiency. But yeah, they're out there. I mean, just last week I was on Kauai in the clinic there, and we were treating people, and at the end of the day, it kind of struck me as I thought, gee, practically every patient that we did procedures on that day were male. So
and I'll tell you another thing. Men are like belligerent. Who cares?
Right.
I don't care what it looks like. I don't go to the beach anymore. I'm a grandfather. I don't need any of that. But in actual fact, your health throughout your system is probably depending on not just the vascular and the arterial that you're talking about today, but it's not just the legs, it's everywhere.
Oh, yeah. Sure.
Okay, so that being said, we're looking at about half of us now?
Half of men?
Yeah.
Getting close.
Yeah, that's
getting close. Yeah. I think probably women are still a little higher. But men, like I said, in our experience, if I had to pick a number, I would say it's more like 40%, not 25%.
Okay.
Another statistic that has to do with venous disease is venous ulceration. 500,000 people in this country each year will develop a venous ulcer. And, that's not only a huge number of people that's happening to, but there's also a tremendous number of healthcare dollars that get spent on the treatment of venous ulcers.
You know what you say, and I never thought about this until today, and that is, percentage-wise, it would mean I have not seen as many ulcers. Of course, I'm not in it every day like you are, on women. The ulcers that I know about were either my own, or I've noticed particularly in the fishing and in the homeless communities and in others that I seem my vision goes to a male having that problem because I just don't see it. But you do. So I mean, it would be. Is it also that there are more women have ulcers than men as well?
I wouldn't say that. I think your observation is probably correct.
Yeah, interesting.
I don't know if that goes to the fact that men are a little more reluctant to, find or seek treatment, and the disease process progresses to that point before they will do anything about it. And I think that's probably part of it. I think women will present with their symptoms prior to them getting that bad. But I would say that it's at least half and half, maybe a little more sided in the direction of men.
Yeah, and one of the homeless providers that I do a lot of other radio with says that a lot of these are because of the squalid condition, and some which it seems like more homeless men are on the street than women. And that's, I'm sure, a good thing, because who wants to see a poor lady out there? But seeing anybody out there. But that means that almost every one of those is likely to have some sort of infection or something that could be looked at as an ulcer.
Right. Yeah. Sure.
Wow. Okay. But that means that there must be tremendous strides being made in the, what do you want to call it, management or healing or partially on working on these things, these ulcers?
Well, yeah, we've made a lot of progress, but it requires the patient coming in, and also in the population that you're talking about, setting up consistent care, and for those individuals to be able to care for themselves away from the office is that much more difficult, in the homeless population, which is a terrible problem. Yeah. But with respect to what part of the world that you might come from, the incidence of venous disease is a little higher in westernized nations.
Wow, I wonder why.
So, well, I think that's probably activity related, and lifestyle. I mean, I think that unfortunately, we're not doing a group in our world, we're not doing too much hunting and gathering. Right,
we're sitting and eating.
Yeah, exactly. So I think that plays a big role. The other aspect of that, however, is genetics. I mean, so much venous disease is related to your genetic makeup, and obviously your genetic makeup is related to what part of the world you're from.
Sure.
So I think it's probably a little bit of both things. Now, as far as arterial disease goes, the incidence in the general population of people having what we call peripheral arterial disease.
Which is, by the way, gang, you hear this kicked around on TV and not stuff, it's PAD.
Right.
And I like the way we're able to grasp these things. That one, to me, makes a lot of sense. Once you know what it is, you start paying attention to it.
Yeah. They, the commercials in the media have started using that term, and I think it's good because, that way people do recognize it for what it is, peripheral arterial disease, or PAD, and that affects 12 to 14% of the general population. So not as common as venous disease.
But at the end of the rainbow, there's some serious stuff.
Yeah, there can be some serious problems with arterial disease. It also increases with age. It's 12 to 14%. So, 15% at younger ages. By the time you're 75, it goes up to about 20%. So, again, same thing as venous disease. With time, it gets a little more common. But one of the most important aspects of peripheral arterial disease, or PAD, is the fact that it's a marker for other problems, specifically coronary disease.
I was going to say the more serious areas of concern.
Yeah.
Like your heart, coronary.
If you have a blockage in an artery going to your leg, then not only do you have to be worried about your leg, but you also have to be worried about your heart, because very possibly the same process that's causing that thing called PAD, which basically boils down to plaquing of arteries. That's the other thing. With respect to arterial versus venous, it's a whole different process. Arterial problems come from blockages in the arteries, And vein problems come from the fact that there's not a blockage. The blood flow just isn't moving the way it should. And that's another, point of confusion when people come into the office. We talk about veins. We talk about the difference of the arteries and the veins. And they have it in their head that if it's a vascular problem, it must be due to a blockage. Mm-hmm. And most of the time, sometimes it is. Sometimes it's a problem with obstruction of a vein. But most of the time, we're dealing with veins that there's no blockage. It's just the function is not proper.
I don't know if it's just a coincidence, but the proliferation of ads, particularly on television at night, deal with a lot of the stuff with PAD, with heart disease and everything else. I guess because there's more and more people more and more doctors want to get people off opioid and other drugs, that they look at some of these other things as, hey, we got to work on the whole person. So are we more prepared to look at our destiny today than we used to? I mean, I don't know anybody. Of course, when I was in my late 30s, early 40s, nobody talked about dying.
Yeah.
Nobody said, what's going to get me? It seems like now television is trying to tell you every night, if you have this, you are at this risk.
Yeah.
So you better get it dealt with. Is that helping us become aware of disease?
I think it probably is. Not only the media, but just I think the general consciousness of this country is, moving so much more in the direction of, health. What activities are going to keep me healthy? What kind of food should I be eating? Yeah. All of those things. I know my children, who are now young adults, I mean, they are much more aware and in tune with those types of things than I ever was at their age.
You got to laugh. My grandson says, hey, Papa, there's MSG in this. He's reading the label.
Perfect point.
I love that. I said, yeah, you're right. And he said, let's not get that. Let's not get that. But, first of all, you got to give some kudos. I know that a lot of people complain and, really criticize education, and rightfully so. But some teachers do one heck of a job. And perhaps a lot of times a kid learns something, and it's something that their parents need looking after. Mm-hmm, and they'll go home and say, hey, Dad, I saw this thing. You got this. What?
Yeah.
Yeah. Okay.
Well, exactly. And I mean, getting back to my kids, I mean, periodically I learn things from them that they're, interested in or learning about themselves. So, but if you have peripheral arterial disease, you've got a 68% chance that you might have coronary occlusive disease. That's a blockage in the arteries going to the heart, and you might have a heart attack. Mm-hmm. So now, in addition to that, about 40% of people, if you have PAD, you may have what we call cerebrovascular disease. That's a blockage in the artery going to the brain. Yeah. So we're talking about, stroke and heart attack. And so, that comes into play continually when we operate on people with peripheral arterial disease. If we're going to do a bypass, down the leg or fix an aneurysm or whatever, you always have to be very conscious of the fact that, this patient has some risk of having coronary disease that they may not even know about yet.
I was going to ask you that, because here's another question. In that we can talk about the venous system and the arterial system, and how many people are confused about the difference between a vein and a artery. The same number of people that I run into don't know the difference between a heart attack and a stroke.
Right.
They think they're just a different way to say the same thing. They're pretty different.
Yeah. Very, very different.
So if you're going to choose one, you probably want to choose a heart attack. I don't know. Probably you're right. Yeah. Probably you're right. I mean, you can survive a pretty bad heart attack, but having a real substantial stroke is it's tough getting over. But you're right. A lot of people will use those terms interchangeably. Mm-hmm. And then the other thing you have to keep in mind is that 50% of people or so with significant arterial disease, they are going to be asymptomatic. They're not going to have any symptoms that indicate that they have some amount of arterial disease. Mm-hmm. And is that tremendously important with respect to the circulation into the legs or whatever? Yeah. No, not as much. But when we're talking about the heart and the brain, yes, very, very definitely. We see in all the cutaways and everything, the veins going down. You see the arteries are sort of inside. You know what I mean? So they don't. Can you see anywhere? Can you see an artery?
Superficially, no.
Yeah, especially if you're not a doctor.
And I think we were designed that way. Because arteries are a little more important with respect to.
Got to keep them pretty shielded.
Yeah, exactly. You got to keep them protected. But the only place there's several places where you can feel pulses. At your wrist.
Sure.
You can feel a pulse on the top of your foot if you know where to kind of feel. And then there's something called the temporal.
Right on the temporal vein or whatever.
Temporal artery. Yeah. And you can see
what I mean?
Yeah, exactly.
Listen, do not, by the way, if you want to learn anything about this show, do not listen to me. I'm just a facilitator.
So
He's a doc.
That temporal artery, sometimes you can actually see it pulsating in some people, So that's the only place that you might see it. But
okay, so what I think the design of our program, and if you go to veinclinicsofhawaii.com, you can see for yourself the length and breadth and some of the things that Doc handles. But I think really there's another thing when you talked about PAD and all of these other things, is that we're now finding out where you are is important. I like maybe if you can remind everybody that venous disease, for instance, there's 6 different classifications, right? And they're not necessarily all divisible, 1/6 different than another.
Right.
But isn't it sort of important that once you are symptomatic of something, that your doc helps you find out where on that chart you are? At what point in the disease what's your starting point?
Yeah, that is an important question, and it's obviously a question that we answer immediately after we evaluate patients. But is it important for that patient to know? Yeah, sure. Because the higher up you are on that chart, probably the more urgently you need to
consider,
be treated. Yeah.
Okay, that's a good thing, and I mean that's a good thing to know, because what I'm just guessing is that, and I think we're all like that. You got to find your limitations, right? You can't build a house if you're only comfortable banging one nail into 2 pieces of wood.
Right.
Yeah. Okay, so anyway, and there's another thing. What about people that have both? Is that very common?
Yeah, it's not real common. Now, we don't have a lot of statistical kind of information about that specifically. But I know in my own experience, I've always been fairly surprised that most people are either one or the other. Yeah. And why that is, I'm not quite sure.
Because they're really connected. I mean, one system leads another, right?
Yeah. Exactly. Typically what we have seen, however, is that patients that are in the more advanced stages of venous insufficiency, those people are a little more likely to also have arterial disease.
Gotcha.
Now, probably that has to do with things like obesity and other related, medical problems, hypertension, diabetes, etc. But yeah, that's if there's any one guideline, that's what we see, and. So you have to kind of evaluate the patient and figure out what is the best way to treat them. So what are the symptoms of venous insufficiency?
Yeah, gang, this is what you're going to want to either really remember or remember to ask about, because it's the key thing that I've been trying to learn since the very beginning. I have risk factors and other things, but knowing what area are you dealing with a vein or are you dealing with an artery? Because sometimes it's quite different, isn't it? The symptoms and the treatment. The
symptoms are very different often. But sometimes they can be very similar too. So it takes a little bit of weeding out sometimes. But typical symptoms of venous insufficiency, probably the highest 3: achiness, heaviness, and fatigue. Those are the symptoms that are most highly associated with venous insufficiency. People would come in with symptoms, and we often try to give them an idea about how good we feel with respect to, is this treatment going to relieve this symptom? And achiness, heaviness, fatigue are very, very reliable symptoms, so they're very reliably relieved by venous treatment. Swelling is another one, very, very common in patients with venous insufficiency. Unfortunately, swelling is not as specific for venous insufficiency as some of these other things, because there are other things that can cause swelling.
Lots
of other things. And we've talked about some of those things on the show before. But swelling is a common symptom. Muscle cramping is a very common symptom. And, we see that's a symptom that often is not usually connected or associated with venous insufficiency. Most people don't even think of it in that terms.
I got to tell you how funny that is that you should say that, because I quite often run into people that know we're doing the show and tell me that what they didn't realize is all of these things that they feel are all symptoms of venous disease. Mm-hmm. And a lot of them feel more than one. They'll get a tingly, they'll get a heavy, they'll get a throbbing, they'll get a achy, and it's just your body telling you over and over again, "Hey, I'm not happy here. Let me show you. Does this hurt? Good. Go do something about it."
Yeah. It's your leg telling you to do something. So swelling. There's something called restless leg syndrome is also is often associated with venous insufficiency. That's where we sort of unconsciously move our legs around because it helps the symptoms get better.
What about this? This comes up before, and I've asked it. Sometimes you'll see somebody sitting at a table and their leg is shaking.
Yeah.
Now that's not restless leg syndrome necessarily.
Probably not. Yeah. Usually, if you see somebody doing that, or like a kid at a table, with the leg going, that's typically not restless leg. That's the nervous leg more than anything. Yeah. But restless leg is something that again you do kind of unconsciously because you're contracting your muscles, and when you contract muscles, it helps vein flow, and it helps the veins function normally, and it can relieve symptoms. If you have achiness or fatigue in your legs, if you just kind of sit and you move your legs around a little bit, it's going to make them feel better. So that's what we mean by restless leg syndrome. And then the other symptoms that we see with venous disease are the typical, superficial things like spider veins and varicose veins, and probably more importantly are the typical skin changes that we can see with advanced venous insufficiency.
You're getting up there with that, right?
Yeah.
Explain that a little bit, that you're not likely to have, these changes immediately.
Yeah. You mentioned the classification of venous disease before, and it's basically divided into three classes. 1, 2, and 3 are, basically varicose veins and swelling. But once you get into 4, 5, and 6, the higher levels of venous insufficiency, that has to do with actual skin changes that we see. And typically we see a darkening of the skin of the lower leg.
Is that most of the time a one-way street? Once it gets to that point, is it pretty hard to make it go away?
Yeah, most of the time. Yeah. When we fix the underlying venous insufficiency, depending on how long-standing it is, the darkened skin may lighten a little bit, but we don't promise that for sure. People sometimes report that back, but
I'm
typically it does not go away.
I'm hoping, Doctor, people are listening, have that, and say, okay, now that I know what that is, I want to see what's inside. It's bad enough to see the outside, but it's indicative that you got some really serious stuff on the inside too.
Yeah. And those are people who may not even have a varicose vein. A lot of people, we see a lot of people with swelling, skin changes, but they've never had varicose veins. It's all due to just strictly the venous abnormality of the function of the deeper veins. But the skin starts to darken, it starts to thicken. It can get real leather-like, and kind of have a granular sort of feel to it. That's just indicating more and more fibrotic changes and damage to the skin. There's something called atrophy blanche, and that's a fancy word for white patches, and basically just has to do with the fact that the venous hypertension that we see in the leg that then gets reflected out into the skin actually is changing, or is actually contributing to a lack of arterial blood flow, and the skin is basically damaged because of lack of blood flow, and then chronic ulceration.
Yeah, and by the way, when you talk about chronic ulceration, I never even really realized it until Doc and I started talking seriously about it. Most of the time when you say, like you say, artery and vein, or like you say, heart attack and a stroke, when you take a look at this next area, it can be very misunderstanding or very misleading to what's really going on. You know what I'm getting at? It's like, hey, wait a minute, what what are we going to do here? I mean, having all these things happen, what are we going to do?
Mm-hmm. Yeah, sure. So now, relating that then to arterial disease, what are some of the symptoms associated with arterial insufficiency? Well, pain is also a symptom of arterial disease. Pain is a symptom of venous disease, but you have to question the patient, and you have to kind of talk about the quality of the pain, the location of the pain, when the patient comes on, or when the pain comes on, et cetera. So the pain that happens with arterial insufficiency is more, so due to a lack of blood flow to a muscle group because of a blockage in an artery. And, kind of the classical symptom that we talk about is something called claudication. And claudication is pain in the calf muscle when you walk. So, what's happening? Yeah, at rest, you're fine, But when you walk, depending on how bad the blockage is, will kind of determine how far you'll be able to walk before this symptom comes on. And what's happening is that at rest, there is enough, even though there's a blockage in the artery in the artery going to that muscle. At rest, the muscle is getting enough blood, getting enough oxygen, so it's functioning okay. But as soon as you start to use that muscle in walking, then that muscle is going to be requiring more oxygen, and enough oxygen cannot get to the muscle.
Yeah, I get it.
And then the pain occurs. So that's a very, very classic symptom, pain type symptom of arterial insufficiency. We ask about that, and we ask how far can you walk before you start to hurt, and then typically when the patient stops walking, then the pain goes away. So that's the other part of that.
That means if you're lying in bed, and one guy said, it wasn't so much in pain, but his legs were so heavy and so dull that he had a hard time turning over in bed. I mean, being in bed was one thing, but he said that I guess he was a heavy snorer, and his wife kept saying, turn over, and sometimes he just couldn't.
Right.
It's just too much of an effort, so he'd fake like he was turning over, and then she'd be on it 10 minutes later, you didn't turn over. But isn't that interesting, because you would think at rest it would be easy, because you got no strain on you. He said when he got up, all that went away.
Yeah, well, that doesn't sound like arterial disease.
Yeah.
That might sound more like venous insufficiency, because and it depends on at what point after you go to bed. Often their venous symptoms become more evident because they've been on their feet all day long.
Right.
They have the pooling of the blood in the lower leg because the blood is settling down into the lower leg. You lay flat in bed. And before that, pooling of blood has a chance to resolve. You're laying in bed. You're not, you're not having other things affect you, and you notice those kind of symptoms. So that's what that probably sounds
like. I got to interject. I've been waiting the opportunity to do this to the doc. I've also seen another thing. Is we've talked about the giant steps that all the diagnostic and treatment equipment in your office has changed. Look at the change in beds. In the last 30 or so years, you can get a bed that can do almost anything, can scuba dive. I mean, beds are now, you want the legs up, you want the legs down, you want it rocking back and forth, you want heat, you want this, you want that. Isn't it amazing how that industry has responded to need?
Oh, yeah. Yeah, they're high tech. Well, they're also expensive.
Oh, yeah, they're right up there. And the old thing was a bed, once a bed is 6, 7, 8 years old, it's time to think about getting another bed.
Yeah.
Not anymore. Beds are $3 or $4 grand. They keep them forever. But isn't that just another way between you and your doc? Sometimes you can just say, maybe this will help. Have you thought about elevating your legs?
Sure.
Every night.
Well, that kind of thing makes it easier to request the patients do that, and much more likely that they will. If you have to go through a bunch of inconvenience to elevate your legs and do so in an unreliable sort of way. Having a bed like that makes it tremendously easy.
Okay, I want maybe if you can, maybe as we talk about the arterial insufficiency, the symptoms, that it's to me it's interesting because you really can't, as a patient, you can't see your arteries. You can't even feel them unless you know what you're looking for. But you can feel these symptoms.
Mm-hmm.
Yeah. So at what point in time does that help when you finally go to the doc? When the doc, by the way, if you go to, veinclinicsofhawaii.com, and if you make an appointment, you're going to get a temporary use of the dreaded Dr. Julep iPad. But it is going to really investigate you to this point where I guess it helps to point a finger at what a patient may have based on the symptoms they describe to you.
Sure. Yeah. And most of the time people don't know exactly what they have.
Or they don't know
that's why they're coming to us. But yeah, if I guess the important thing is if you have symptoms of the type that we're talking about, then you probably need to have it looked at. Definitely. So, going on with the arterial insufficiency symptoms, in addition to pain, the skin of the feet might become pale.
Mm-hmm. Pale.
Now that's again in contrast to Venous, where it's going to be
dark,
more sometimes bluish and purple. The skin of the feet and the lower legs start to lose hair, and that's just because of a lack of blood flow in PAD.
Because hair is protein, and hair is a living thing, right?
Yeah. So
if you have something, if you have it all.
Yeah, as I recall, I don't remember that anymore. But
those were the good old days. Yeah.
Skin becomes kind of thin and shiny. Mm-hmm. The skin becomes cool. Obviously, you have a loss of pulses in the feet. I mentioned that you can, if you know where to feel, there's actually two different areas where you can feel pulses in the feet. You start to lose your pulses. Numbness and weakness can be a symptom of PAD. Now, some people with venous insufficiency will also have numbness, tingling, those kind of symptoms. But typically weakness is not a symptom of venous insufficiency, more having to do with arterial insufficiency. Erectile dysfunction in men is, sometimes a cause of, or is caused by lack of arterial blood flow. And then at the more advanced stages of arterial insufficiency, if people begin to have pain at rest, we refer to that as rest pain, where even without walking or without strenuous exercise, without activity of the muscle, they're not getting enough blood to the lower extremity, and they can actually have pain.
I got a question on that, and that is I have actually used for a long time the compression stocking that we talk about. It's actually a garment, not a sock. It's a medical garment. But elevation is so terrific. But I have noticed sometimes when you stay elevated for too long, it hurts, and you think, why is this hurting? I'm doing all of this fluid's left me, but maybe enough hasn't been able to get back because you don't have enough pressure going to go uphill.
Well, that would be if you don't have arterial disease, that would be unlikely. Mm-hmm. You should have adequate, pressure in the arterial system to transport blood. But if that might be an indication of arterial disease,
that's what I was asking.
If you elevate and you start to have these symptoms, as a matter of fact, people with advanced arterial insufficiency, when they start to have rest pain, when they first start to notice it is when they go to bed at night and they elevate their foot and they start to have pain in their foot just because they've elevated it. Yeah. And often you will hear the story of somebody actually, hanging their foot over the edge of the bed to be able to sleep because that gives them a little more downward pressure of blood.
Very, 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 very interesting because I know that sometimes in some treatments you should lie on your bed with your legs up against the wall, straight up and down. Yeah, and that sounds good on paper. Mm-hmm. And some people just aren't physically built to be able to do that. Right. But by the same token, I could certainly see where what you're doing is you're just draining every bit of fluid out of your leg. Yeah. Straight up in the air.
And theoretically, if someone has venous insufficiency, that is good. Yeah. We tell people to elevate their legs all the time, and there's a variety of different ways that people come in and say, I do elevate my legs. Well, what that means to some people is sitting in a chair and putting their leg up on a stool. Well, that's not probably adequate. The best way to do it is for somebody to lay flat and get their legs up on 2 or 3 pillows. But the higher above the level of your heart you get your legs, the better, the drainage is going to be.
That's fascinating. And by the way, there's another thing too, and that is we talk a lot about ulcers, a lot, and I didn't see ulceration on a artery list until today. Mm-hmm. And so I'm guessing that is it sometimes difficult to tell if somebody has an ulcer, whether it's a vein ulcer or an artery ulcer?
Usually it's pretty easy to figure that out.
Mm-hmm.
But yeah, that's another one of those signs or symptoms that can be present with either venous disease or arterial disease. Luckily, when it comes to ulceration, the appearance of the ulcer is going to be very specific for what's causing it. Okay. There's venous ulcers. There are arterial ulcers. Another category is something that we call diabetic or neuropathic ulcers, and they all have very very different kind of appearances.
Is where they're located sometimes indicative of what the problem is?
Yes, yeah. Part of it is their location. Mm-hmm. Venous ulcers are often, most of the time, around the ankles and lower leg. Kind of more so on the inside, kind of what we call the gator area,
sure.
And they have the ulcers of venous insufficiency are a little more irregular in their border. They've got kind of a granular kind of base, whereas arterial ulcers are a little more distal on the foot. They're more toward the lower foot and toes. And they're smaller. They've got a little more demarcated edge, and again the foot just looks like it's lacking in blood flow. It's often pale, and the skin is cool, etc.
I can hear people. I can see people listening to the show with a mirror and checking everything. This is good.
Yeah.
If you've got something you've never been explained before, and it happens to be hitting right where you think it's hitting there, that's a good indication that finally you know what this symptom is a result of. Mm-hmm. And heaven help it. I mean, some people say pain is bad. Pain is good, or swelling is good if it's going to help you get cured.
Right, right. Wow. And we're talking about venous disease versus arterial disease, and we primarily treat vein problems. However, we evaluate everything. So if there's somebody out there and they don't know whether their problem is due to arteries or veins, please come on in. We'll be more than happy to help you figure it all out. And if it's not something that we take care of, we'll be more than happy to get you to somebody who does
recommended.
Take care of it.
That's really, really cool, and it's just another way that the Dr. Julep and Vein Clinics of Hawaii network. And don't forget, there's 4 offices: Hilo, Big Island, Maui. Big Island and Maui and Kauai and Oahu. And you're never too far away, not just from a clinic, but a network of others that are all working together to make sure that the patient gets diagnosed and treated by the right specialist at the right time.
Yeah. And we can do that in all the offices. So what are the risk factors of venous disease? And we've kind of gone through this before, but, genetics plays a huge role for people who have a parent that has, venous disease and may have had vein stripping in the past, something like that. They have about a 60% chance of developing venous insufficiency themselves over the course of their life. So, better than 50-50 chance. Mm-hmm. If you have both parents having had venous insufficiency, then it's even higher. It probably is in the range of 80 to 90%. So it's almost a foregone conclusion that you will have it. Yeah. So genetics plays a huge role. Age is another risk factor, and again, we've kind of talked about the fact that age just reflects the fact that the process has been around for a lot longer, and at some point you're probably going to become symptomatic. Women have it a little more, but I think men are gaining. Multiple pregnancies is a risk factor for venous disease.
Is that right? Yeah.
So,
I think we've explained that before, and guys that you don't know, is the biggest difference between us, I guess, is in the pelvic area and what goes on there, particularly during pregnancy, right?
Sure.
So that's why the women, and bless them for keep doing it, because they do get some real concerns during that period of pregnancy, don't they?
Yeah, and there's a number of different reasons why. Why specifically during pregnancy, or why pregnancy is hard on your veins, and we won't go into that. But we've talked about it before. But the risk. So usually it's you've got some genetic predisposition, and then that's sort of the basis of it, and then some of these other things come into play. But multiple pregnancy is one. Obesity is another. We see a tremendous amount of venous insufficiency in obese patients. Getting back to pregnancy, the hormonal changes of pregnancy and menopause. So there are hormonal factors why people might develop venous insufficiency, and then the other big one is people who work on their feet. So if a parent had varicose veins, you've had 2 or 3 children, and you work retail, then you're probably going to have venous insufficiency.
I got to remind you. I think I've quoted this guy before, but maybe, gang, you listening haven't heard this before. I had a friend who was a banker and sitting down for a 35-year career, and he retired, and he was, financially well up and lonesome. His wife had passed, preceded him in death, and so he took a job as a sampler giver out at a big box, where they stand around all day and give people snacks to eat.
Sure.
And nobody has a bad time doing that because you're giving somebody a helping on their craving. Give me, I want that. Can I have 2? Can I have 3?
Yeah.
And he had to quit because his legs couldn't. He got home every night and his legs were too sore.
Yeah. Even
a couple of hours, but it made him think, okay, I need to do something. He didn't realize how bad off he was, and now I think he's on the road.
Yeah, and I'm sure he probably had venous insufficiency for many years, and it was sort of masked because he wasn't on his feet a lot. But yeah, that's we hear that all the time. People, many of our patients are in some sort of occupation where they're on their feet a lot, and they talk about how bad their feet and legs feel at the end of the day, and it's just kind of a progressive thing. They start out the day and they're pretty pain free, and then throughout the day it just gets worse and worse. But some of the risk factors of arterial disease, on the other hand, are things like smoking, diabetes. Obesity is also a risk factor for arterial disease. High cholesterol, high blood pressure, age, genetics, family history of PAD, family history of heart attack or stroke. And then there's something called homocysteine, which is a marker in our blood that has to do with the potential indication of arterial disease. But that
was a miserable list, by the way.
Yeah,
that's all the bad stuff, right?
It is bad. Yeah. But I guess the thing that that kind of stands out is that there's so many things that we can do to change the course of arterial disease. For instance, smoking, obesity, high cholesterol, these types of things. Those are all things that we can really change our lifestyle and impact those risks.
I know there's a lot of people that are really wrestling with being able to completely stop smoking. Mm-hmm. But what's happened is a lot of these people that have gone to alternative methods for the nicotine are now just as swamped in a habit as they were when they were smoking cigarettes.
Yeah.
So I guess the big awakening is when you start seeing all these lists and find out that smoking's on all of them. You're playing with
fire.
You're playing with the problem.
So that's the good thing about arterial disease is that there are avenues by which a patient can try to alter the course. And not only try, but actually achieve the ability to alter the course of their arterial disease, and not so much with venous. Venous disease is something that it's not affected by diet. I mean, it's typically not going to be, the progression is not going to be affected by us, stopping smoking or us, controlling our diabetes better, or us making sure that our cholesterol level is in a normal range. So I guess the one good thing about arterial disease is that we can impact it if we, take the steps to do that.
Yeah. And by the way, this is a well-beaten path. Once you find out where you are and what you need, it's amazing how the treatment programs have been designed to get right in and start working right away. Once you made a decision through your diagnosis, doc, and my filling out the questionnaire and my previous medical records and all of this stuff, it's pretty easy to see here are the things most likely to be causing a problem later, and here's how to fix them all.
Right.
I don't want to say fix them all. I want to say here's how to deal with them, manage them.
Treat them, yeah. Manage is a good word, yeah.
Okay, so that being said, let's move on before we get kicked out of here for time on some of the other things. So the risk factors were for arterial disease. But what about when both are combined?
Yeah, that's not sometimes it's not clear, but sometimes both are present. Now, if we look at just the symptoms of each one, for instance, pain, arterial pain comes on with activity, like we were mentioning before. Venous pain in general is relieved with activity. Mm-hmm. So, getting back to, if in arterial disease, muscles are contracting, there's not enough oxygen getting to those muscles, and the muscle starts to hurt. As opposed to in venous problems where when the muscle is contracting, it's actually facilitating the function of the vein. Mm. So the discomfort that you might be having from venous insufficiency will be relieved. Arterial pain gets worse with elevation, like we were talking about just before. And like I said, a lot of people they lie flat, and all of a sudden they find that their foot starts to hurt. Well, that just means that elevating just that much, just from them sitting to a lying position, alters the blood flow to the point where they develop pain because they're not getting enough blood. Venous pain will actually get better with elevation. So now arterial pain is a little more sporadic and related to activity. Venous pain can be a fair bit more continuous. Mm-hmm. So, arterial pain comes on when you're active, then it goes away when you relax. Venous symptoms seem to be a little more constant and nagging throughout the day, and the symptoms, worsen throughout the course of the day.
Okay, we are going to have a time constraint. I want to make sure that we are able to mention that you have this guy on the Big Island, a guy on the Big Island, 70-year-old guy. What was the example that we wanted to cite with him?
Yeah, he came in with a mixed sort of problem. Mm-hmm. He had varicose veins 10 years ago. And he had some swelling in his ankles and a little bit of, venous type discoloration, no ulcers. But in more recent months, the quality of the pain sort of changed. So it changed from that, constant, dull, throbby kind of pain to a little more sporadic pain and related to activity. In closer questioning, he had pain that was definitely would be referred to as claudication. Came on after walking less than a block, and those are all obvious symptoms of arterial insufficiency. And we had to do an arterial workup on him too. So, and that's not an unusual thing. I mean, we often do that, but the point is that when we are dealing with patients that might have both venous insufficiency and arterial insufficiency, the first priority is to take care of the arterial insufficiency, because if there's not enough blood getting down to the lower leg, and we start to do some of the things that we do to correct venous insufficiency, then there may not be enough blood flow getting down there to heal.
Yeah, which we don't want to happen. Right?
Yeah, we don't want to make things worse. Yeah. So typically we evaluate the arterial system. We may even intervene on that patient in an arterial sort of fashion to improve their blood flow, eliminate the arterial insufficiency as a factor, and then we move on to their venous insufficiency.
Okay, I'm hoping that, and we could do another 3 hours continuing along this vein, and this artery, because that's what we do. However, you need to know more about this, and I'm sure that everybody listening has heard something today that they are dealing with, and that means it's time to have a look. And you can do that on 4 islands. Go to veinclinicsofhawaii.com. veinclinicsofhawaii.com, and call the office nearest you, make an appointment, go get evaluated, and more importantly than that, it's really to just identify what's going on with you. That's why we do this show. So once again, if you want to hear something on the show, drop us a line. Just go to veinclinicsofhawaii.com and hit the Contact Us button, and we'll be happy to deal with you. So for Dr. Juliff and everybody at all clinics on the 4 Islands, thanks for listening, and we'll see you next time on Vein Clinics of Hawaii Show Radio.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.